This is Congresswoman Marsha Blackburn, Republican of Tennessee. Always nice to see you, Congresswoman.
Good to see you. Thank you.
Thank you. And first, of course, we want to start and say that we wish Senator McCain a full recovery,
Yes.
a very strong man, and we want him to heal well.
Yes.
Absolutely. So let's start here with you, Congresswoman. How do you think this delay affects the Senate's health care bill?
I do believe that it gives the Senate the opportunity to work a little bit more on the bill. They will get their CBO estimate tomorrow, and that will give them a few days to do some fine-tuning. And once Senator McCain is back to full health and returns to D.C., they'll be able to call their vote. I know they're looking forward to it. We in the House are looking forward to them taking this vote. We all want to begin the process. And Arthel, it's important to realize it's a process. It's going to take us a couple of years to get everything off the books and to restore our nation's health insurance and healthcare delivery systems to full health and centered on the patient instead of centered on the federal government.
And when we get to specifics, Congresswoman, do you support the latest draft of the GOP Senate bill, full stop, or are there areas of concern for you?
There are areas of concern for me, as there are for many. The way they approach taxes is something that is of concern to me. I also want to make certain that the states, who have been telling us for years, our governors and our state elected officials have been saying, send Medicaid to us, full and total, let us have it. We can deliver a better product at a more affordable cost and take better care, making certain that individuals have access to affordable care. So our states, we want to make certain that we do send Medicaid back to the states.
And of course, you are no fan of Obamacare. But given the uphill battle to repeal and replace it, is it time to perhaps start looking at fixing the faulty elements of Obamacare, or do you stand by the need to just throw it out and start from scratch?
What we have learned, Arthel, is that this is structurally flawed. There is no way to fix this marketplace except to take the health insurance marketplace, the ACA marketplace, down. Right now, when you're looking at in the 2018 insurance year, 44% of the nation's counties will have only one or either no provider of a marketplace insurance plan. So that means you're putting individuals in those counties in the crosshairs, if you will, for IRS penalties and with lack of access to a marketplace compliant plan. So it is unfair to penalize them, and it is unfair to turn to them and say, well, others have subsidies, but you don't because you have no marketplace plan. And bear in mind, it is 44% of our nation's counties that would find themselves in that position. So preserving the status quo doesn't work. This is structurally flawed. We have voted, I think it's 26 times, to amend portions of the Affordable Care Act. What that has not done is fix it, because you can't fix this. You need to take it off and start over.
And are you willing to work with Democrats on a new health care bill?
Oh, absolutely. And we continue to invite and encourage our Democrat colleagues to work with us on this so that when we do the repairs that are necessary for the Affordable Care Act and we move to a new posture, it is something that is going to be workable and provide certainty and stability for both the health insurance marketplace and the delivery systems, and I will add also for the reimbursement systems for our healthcare providers. So doing this in a bipartisan way is something that is much preferred rather than having it be something that is just going to be a partisan battle.
So then what do you think about right now? You've got all the Democrats saying no to the current draft of the GOP bill.
It is disappointing to me, and then many times they'll come to you and say, well, we know something's got to be done. We know the marketplace, the insurance marketplace is imploding. Health insurance premiums in my state, Tennessee, have gone up 176% since this went into effect. You cannot sustain that. We also talked to constituents yesterday in my district, talking with individuals that are self-employed who would say, I can't afford this insurance. I talked to one family that with their premiums and their deductibles combined together, they are out of pocket $30,000 before anything kicks in. Now, their combined household income is just over $75,000.
Clearly,
so
they
think
can't
about
afford
that.
that. Yeah, exactly.
That's right.
I
It is
understand that.
very unaffordable. So you have to do something. And our Democrat colleagues, they're hearing the same thing, and they know something has to be done also. I find it so unfortunate that it's become such a partisan debate. We're ready to do these phase 1 items. Let Dr. Price handle phase 2 with the things he can do.
Congresswoman,
then phase 3.
I beg your pardon. If I could get a really quick answer on this. Of course,
Sure.
you know the President Trump has cast doubt on the CBO scoring of health care.
Yes.
Do you have confidence in the CBO score?
We have a doubt about CBO because they were so far off base when they did the first scoring for Obamacare. Their estimates of the number of people they expected to be in the marketplace were so far off base. So I know that I expect their estimates are going to be off again. Bear in mind, 19 million Americans chose to opt out or to pay the penalty and not go into the Affordable Care Act marketplace. So CBO, they just had not estimated that properly, and I don't think they're going to estimate it properly this time around either, but I look forward to hearing what they have to say.
Okay, Congresswoman Marsha Blackburn, very nice to talk to you. Enjoy
Good
the
to
rest
be
of your
with you.
day.
Thank you.
Thank you. Eric?
And